I play baseball now,
Yeah, in the baseball team.
like fielding, like batting.
Well, Jayden was born with sickle cell disease, so I knew before I had him that he had sickle cell disease. He was just getting sick almost every month, every few months with pain crises, infections, high fevers. He ended up in ICU. So the doctors said that if Jayden doesn't get a bone marrow transplant, he's not gonna live a healthy life, or he might not live that long. And we found out we were pregnant. So they advised us that once I gave birth, we should test the baby, if the baby was healthy and didn't have sickle cell, to see if it would be a match.
You know, I know the struggles that these families have. I know that the life expectancy of a patient with sickle cell disease is only about 45 years of age. So, you know, I know when families come to me for a cure, the desperation that they feel, and really their goal is just to give their child a better life.
So once Justin was born, they tested him. He didn't have sickle cell, but we had to wait till he was a year to test to see if he was a match for Jayden for a bone marrow transplant. And once Justin hit a year, we did the test, and a few weeks later we found out it was a perfect match. Those were the doctor's words, that we were lucky because it was a perfect match.
Over the last 8 years, we've transplanted about 40 patients with sickle cell disease, really making us one of the larger centers in the country. Our outcomes are great. We're actually doing a lot more novel therapies than some of the other programs. And we've seen children's lives change.
Before he had the transplant, when he had sickle cell, he was in the baseball team, and he would get short-winded really quick. He would have to sit down, and even after one game, he ended up in the ER. He was dehydrated, and now can't stop him. I mean, he is incredible. He is fast. He's just doing so well. Such a big difference. Big difference.